talk, and to talk more about the research being done, we're going to have Dr. Donald Ponec come up in just a moment. Donald Ponec, MD, is a fellow of the Society of Interventional Radiology, co-founder and medical director of the San Diego Cardiac and Vascular Institute, and president of the Cardiovascular Health Institute at Tri-City Medical Center. He is involved in leadership and development in cardiovascular healthcare while maintaining an active clinical and research practice. Dr. Ponec attended USC as an undergraduate, summa cum laude Phi Beta Kappa, UCSD Medical School, and completed a radiology residency at UCSF, followed by a vascular and interventional radiology fellowship at UCSF. He moved to San Diego in 1990 to start an interventional radiology program and practices at a number of North County San Diego hospitals and outpatient facilities. He is one of the 3 IRs performing venous angioplasty as part of the Hubbard Foundation CCSVI study in San Diego, and he was the doctor that treated my brother Devin Hubbard for CCSVI in May of 2010. Let's welcome Dr. Donald Ponec.
Well, thank you, and thank you all for coming, and thank you for the opportunity to present some information on the clinical outcomes of the trial that we're doing. Appreciate the opportunity from Dr. Hubbard to participate, and thank you for putting this together. When this conference was first being thought about, I promised to help with the development of the conference, which I made one phone call to Dr. Dake, and he agreed to come. That's all I did. I mean, it was an important phone call, but it was not a lot of work, and really the Hubbards have done a great job of putting this together, and I'd like to thank you. And before I talk about the results, I just wanted to acknowledge and encourage the advocacy of all the patients here. It's unusual, I think, in medicine to see this kind of political involvement and support from patients. We don't see this at our meetings when we talk about patients who have osteoporosis and need a procedure for a fracture, or have hypertension and they need a stent in their renal artery. This is very unusual, and I think you're doing a great job of organizing it, even though you're frustrated that things aren't moving quickly enough. From our perspective, things are moving very quickly. We're really on the fast track toward getting research started, and you're working politically and through CCSVI Alliance and other mechanisms. You're doing a great job, and it's hard work. And just one funny thing with regard to the politics is a lot of times we'll say when something wasn't really hard, we'll say, well, it's not rocket science, right? Because we'd all acknowledge rocket science is really one of the most difficult pursuits. And so NPR thought about this for a minute and said, well, what do rocket scientists say when they want to express that sentiment? What do they point to? And so they asked some rocket scientists, and they went about a study. They're scientists. And so they did a survey, and they came up with politics. Because and this is a true story, they realized that there are so many variables and the rules keep changing. There's really very little predictability when it comes to politics, and so your efforts applied properly can really have an influence on what's going on, because you really probably are changing the rules and the way things are going. Well, with that said, and after that introduction, which leaves me nowhere to go but down, I'm going to launch into this. So our study is a single-center investigator-initiated efficacy trial, and kind of a fancy term, but it's an extension of the fMRI trial, which is going to be presented a little bit later, where we continue data collection on self-referred or physician-referred patients who had documented MS by objective criteria, by standard testing with MRI or other techniques. Patients underwent MRV, and they hate you protocol as a qualification to participate in the study, and then subsequently underwent venography or venoplasty to treat so-called CCSVI. And just, I'm not going to show many pictures because Dr. Saxon and Dr. Gooding are going to go into significant detail on this, but this is essentially what we're talking about. And this is a jugular vein, and there's a catheter up here, and we're injecting dye, and we see at the bottom, well, I apologize, it's not a great image, but there's a narrowing here, and we see collateral veins filling, and so here we placed the balloon and dilated it, and afterwards we see the veins now open, and the collaterals aren't there. And so the question really is, and I think brilliantly articulated, is now what? What does this mean, and how do we measure what it means? And there was a paper just published in JVIR, this is the Interventional Radiology Journal, this past week, that summarized what the research agenda for the evaluation of this disease and the techniques should be. And we're fortunate to have three of the participants, Dr. Dave, Dr. Hayden, Dr. Hubbard, here so they can help us with this. And we all recognize a randomized control trial is where we need to be in order to demonstrate this, get funding for it, to replicate the results and really start to understand it. The problem is that we need some information before we can really figure out what to study. What are we going to measure? What's the study population going to be? We really need to optimize and standardize how we're going to diagnose the abnormality and what the interventional technique for treatment of the abnormality is going to be. And then we have to agree on what we're going to measure and call success, which we heard earlier. So the panel encouraged that investigators initiate either single or multi-center studies on safety and efficacy as registries as a first step toward getting information. Now, in the literature review, there have been other authors and experiments performed, but the published paper has already been described at some length. And this is the only published clinical outcome trial. And again, it was 65 patients, 18 months of follow-up, and they did demonstrate improvement in outcomes using standardized methods for testing, although perhaps not reference standards. And this is enough, we think, as it was said, as a pilot study to encourage us to do more research. So our design is that of a registry of consecutive patients who demonstrated abnormal flow. They underwent venography and angioplasty for what were judged to be hemodynamically significant lesions. We used some stents in certain situations, which I think my partners will talk about, but rarely, 9 total in over 300 patients. And so we're hesitant to do that. And patients were treated as outpatients in an ambulatory center for the most part. Patients were self-referred either by word of mouth through social networking or websites, or physician referred to the foundation or to San Diego Vascular. There was no active recruitment of patients or advertising for the trial. Again, the MR was the objective qualifying entry criteria for participation. Patients all completed validated clinical status measures at intake, and then at 1 and 6 months after the MR testing and venoplasty, patients were largely self-funded, and it is an IRB-approved trial through Palmerado Hospital IRB. The data have been analyzed by statisticians, and they did a random effect regression analysis on the measurement tool, which was the MSIS-29 physical and mental health scores, run over time, and then try to understand or at least point to which variables may be affecting the outcomes of those survey tools. And this is the demographics of our study population. This is the first 265 patients. The distribution is about what we see.